the orthoPAC, hosted by Sam Dyer. Welcome to the orthoPAC, where we discuss up-to-date orthopedic topics for the busy clinician. I invite you to sit back and relax as I attempt to fill in the gaps between education, current events, and real-world practice. Listeners, welcome today Dr. Robert Baranello. Dr. Baranello is going to talk to us about some strategies in interventional pain management. Before we get to the podcast, I want to remind everyone that the PAOS annual meeting is in Nashville, September the 2nd through the 6th, and it's going to be at the Omni. And there is a room block. I think that was extended as of the date of this podcast. I'm not sure, but get yourself registered and get your room reserved, and I hope to see you there. Okay, on with today's podcast. Dr. Robert J. Baranello is a board-certified anesthesiologist and accredited counsel for graduate medical education, fellowship-trained interventional pain management doctor. He is passionate about helping his patients regain function and quality of life through an accurate diagnosis and targeted pain treatment. During his academic career, Dr. Baranello has published several peer-reviewed journal articles and spoken at regional and national meetings about anesthesiology, pain medicine, and neuromodulation. Clinically, he is interested in using interventional techniques as part of a multimodal approach to pain management using precise and specific therapies. Dr. Baranello, welcome to our podcast.
Thanks for having me.
Yeah, we're glad to have you. So I'm mostly basing today's podcast on a presentation you gave in Tennessee. There was a pain conference in 2023, and the title, which I have privy to the PowerPoint slides, and I'm kind of going to look at those a little bit as we go along. Neuromodulation, a tool for functional restoration and pain relief. And today's podcast, like I said, is going to center around that. So I was thinking, as a starting point, maybe we should know more about neuromodulation, what it is and how it works. So I was hoping you might shed a little light on that for our listeners.
When you initially asked about what I wanted to be talking about on the podcast today, I think a lot of this is based off of a talk that I gave a couple years ago as a fellow. And so just to keep it, I guess, as narrow as possible, our plan was to probably talk more about spinal cord stimulation, peripheral nerve stimulation, and dorsal root ganglion stimulation. But the field rose even into, functional neurosurgery as far as transcranial therapeutic ultrasound, certainly deep brain stimulation, both for Parkinsonism and for seizure disorder. And so some of those things are certainly outside the scope of my practice. But for, some of the listeners, either patients or practitioners, the field is ever growing and indications are growing as well.
So if we talk about more specific, the spinal cord stimulation, the dorsal root ganglion, and peripheral nerve stimulations, you had made a point that your objectives in the talk were defining the anatomical targets for these types of treatments as the first objective. Starting with that, can you please explain what are some targets for these treatments and what are some common indications for those?
Sure. Yeah. So generally, the way that I broach the subject with my patients is just a brief discussion about anatomy. And I usually use an example of like a highway system or picture a local map of like a city or a town. And so the idea behind the analogy is the big interstate that's running through your city or town is more like your spinal cord, and it's sending and receiving painful signals as well as temperature, touch, and motor signals all day, every day, right? And then there's several different branches as we go further and further with different checkpoints along the way, all the way down to our peripheral nerves. So again, think about your median ulnar nerve, sciatic, femoral nerve. So those are more peripheral nerve branches. And we can change the way that our brain sends and receives those painful signals. And so, for example, spinal cord stimulation, also known as dorsal column stimulation, is just that, trying to target the spinal cord, or more specifically, the dorsal columns of the spinal cord, which is the most posterior aspect or anatomic space of the spinal cord. And then, for lack of a better terminology, peripheral nerve stimulation is just that, stimulating just the peripheral nerves in terms of trying to compete for your brain's attention and try and get pain relief in that way.
I got it. And then some of the indications you talked about, you had kind of put some together. There was post-laminectomy syndrome, diabetic peripheral neuropathy, chemo-induced peripheral neuropathy, and complex regional pain syndromes. And I think that was the spinal cord stimulation. Is that correct, Dr. Baranello?
Yeah, and I think if you really dug deep into more of the literature, you'd find that there is quite a good bit of overlap. So if we want to talk a little bit about indications, someone who comes in for post-laminectomy pain syndrome, so someone who's had low back surgery and who has persistent back and leg pain despite having that more formal decompression, that is more of an indication for spinal cord stimulation as opposed to complex regional pain syndrome, someone who might have a crush related traumatic injury or even a distinct peripheral nerve injury from, say, foot and ankle surgery. Both spinal cord stimulation and dorsal root ganglion stimulation would be indicated in the treatment of that neuropathic pain syndrome as well.
Do you have any experience with the limb amputations and phantom pain using these kinds of treatments?
Yeah, so I have one patient who comes to mind. It was a patient that I talked about in this talk actually, and there was somebody who I saw in fellowship. She of course had gone through the gamut of conservative options. Just for the sake of saying it out loud, phantom limb pain is a sort of neuropathic pain syndrome where patients can have ongoing, essentially phantom limb pain after amputation. So that could be foot and ankle or a below the knee or above the knee amputation. And patients can still have, quote unquote, foot and ankle pain despite having that limb having been amputated. So the patient who I have in mind maximized conservative therapy as much as possible, anti-neuropathic pain medications. The list went on and on and on, and still had such terrible, debilitating phantom limb pain. And so wound up coming to us for more long-term pain relief. And that's sort of where some of the peripheral nerve stimulation came in. So by targeting peripheral nerves, in this instance, the sciatic and femoral nerves, we were able to essentially provide this patient with quite a good bit of pain relief and functional restoration after the fact. I mean, I remember when I saw her post-operatively, she would lay in bed and cry at night, and she was finally able to get some sleep and have some meaningful functional quality of life back. And so that's the difference between some of these things that we're able to offer.
I mean, that's great, as a almost like a last resort. Listeners, stay tuned next week when we continue our discussion with evidence that supports neuromodulation as a safe and effective treatment. All of our listeners who are PAOS members or who are interested in some quality orthopedic education, consider Nashville, September 2nd through the 6th. Thank you again for listening to the orthoPAC.